As a country, Uganda faces an enormous challenge of orphans who are on the increase. Based on the 2002 Uganda population census and an estimated 3.5% increase in the number of children of 0 to 17 years of age, it is estimated that there were over 2.5 million orphans in Uganda by the year 2010. This indicated that there was a huge increase in the number of orphaned children. The effects of HIV/AIDS and a civil war in the northern region of the country since the early 1980s have contributed to the large numbers of orphans. That is in addition to tropical diseases with a high incidence of malaria, which claims thousands of lives annually. These orphans include children who have lost one or both parents but are vulnerable to abuse or harm due to misfortunes such as being HIV positive, living with a chronically ill parent, living with very poor grandparents, or living in poor child-headed households. With the poor medical health system in Uganda as a country and the limited access to medication like ARVs, people's lives are always at stake. This is in addition to the civil strife that has marred the country for decades, pushing more than 1 million people into concentrated camps where they become extremely vulnerable. The people living in camps, for example, have been dehumanized, and because they have been reduced to hopelessness, they only find pleasure in sex and other activities that expose their lives to sexually transmitted diseases, including HIV/AIDS. Kampala, the capital of Uganda, is at the moment experiencing an influx of street children who are running away from the harsh conditions in their villages and are dependent on begging with no shelter. Majority of these children have lost both parents and have not been adopted by their immediate relatives or foster families. Away from the hundreds of street children across major towns of Uganda, there are hundreds others suffering locally in their respective villages. One of them is Chosimire Provia. After the death of her father at the age of 12 years, she became the sole bread earner for the family, taking care of her mother, who was bedridden. She would do manual work and work in people's gardens, where she would be paid some little money or given some food. She would then buy medicine for her mom and pay school fees and buy books for her brother, Lemegio. In a few years, the mother died and she remained with her brother, and she, Provia, became the head of the poverty-stricken family. The local leaders, who are also very poor, resorted to contacting Education and Women's Aid, Ewa, who rescued these children and have continued to support their education. Lemegio is now a senior 4 student at St. Henry's College, and Provia is at Entebbe Air Force Secondary School in senior 2.
We were implementing a different project when we came across Provia. And when we came across Provia, the mother was attending TASO. She was an HIV positive lady. And what we decided to do is to empower them. We gave them some maize to plant, we gave them beans, we gave them some goats to rear. And we thought that it would help them. Indeed, it helped them. But after about 2 years, the mother died. But during the period when the mother was sick, Provia would go to look for jobs. She would leave school. She would not attend school. She would look for petty jobs. She would go in people's gardens and they give her either food or some money. And some of the money she would use to buy medication for her mom. The brother kept in school. Provia would support the brother. She would buy the uniform for the brother. Then for her, she would attend a few days. Right now, she's like 3 years behind her brother. Her brother is in senior 4, she's in senior 2. Because she had to take care of the family. So after their mother died, the 2 of them were completely lonely and alone, and they didn't have anything to do. We were actually called by the LOC, the local council leaders. The local council leaders called us and really begged us that come to the rescue of these children. So we went and rescued the children and took them to school. And today, Provia is very happy. She's behind her brother, but she doesn't mind. And she's working hard and she will make it.
There are many other children who are in similar situations, but currently Ewa has limited resources and can only reach a few. Priscilla Apio is currently a student of medicine at Makerere University. She lost both her parents at a tender age of 8, and she was adopted by her cousin brother together with her twin sister Patricia Adong. Her cousin brother was only able to educate her to attain high school education and was not able to pay school fees for tertiary education. She always yearned to study medicine until her chance was almost shattered when her brother could not afford money for private sponsorship.
I was in my senior 5 when I was given a combination of PCB, agriculture. That's when my dream of becoming a doctor came into reality. I always hoped and prayed to God that I should become a doctor.
With the support of Ewa, she was able to get sponsorship by Miss Miriam Hudson of Heritage Grandmothers of Vineland, Ontario, Canada. Priscilla makes a reflection on what would be going on with her life if she had not gotten the support.
I sit back and remember, like the time when our parents passed away. That was in our primary 3 and primary 4, respectively. But then I sit back and think, if there was no one to take us up, where would we be today? We would be still like the way we have seen our other friends who have dropped out at school. Yes, I see we would also be in that same path now, probably in the village, somewhere with I don't know how many children, maybe 6, 7, married, maybe being mistreated by, I don't know who would be married to by now.
Philip Akankwasa's situation is not any different from that of Priscilla. He lost his father while he was in primary school. Because he's the last born of the 11 siblings, he was dependent on his aging mother, who is also chronically ill.
My mom is a small-scale peasant, and the funds to raise to take me to A level were much more bigger than her capacity. So actually, the first term I was at home with no any other support to continue, any other father. It is until when the director Ewa was passing through the village and saw that I had the capacity to continue.
Akankwasa, who is pursuing a bachelor's degree in geology and chemistry at Macquarie University, is the only one in the family that has attained education after all his 8 siblings dropped out of school at primary level. He asserts that his life is now progressively having a bright future and uses the same breath to appeal to donors and people of goodwill to lend a hand and support more orphans who are in acute need just like himself. The education in Uganda is becoming more and more complicated, especially since it has been so commercialized. Education in Uganda has remained for the rich, and the poor are being denied this fundamental human right because of their state.
Had it not been the help of Ewa, hopefully at this moment I would be at home just doing nothing, because without education you are somewhere in a far place where you are not having anything.
We support the children in education, soliciting for assistance for them. And then after getting the assistance, we make placements in schools and we support the children holistically.
From inception, Ewa has supported 504 children in both primary, secondary schools, vocational and university education. Presently, Ewa is looking after 96 vulnerable children to have access to education, taking care of all their needs, and have built a home for them where they live today.
When we started supporting the children, the holiday time came and some of them didn't have where to go. Sometimes we would help them ourselves. Our volunteers and staff would take a child. I would take children to my home and keep them. So we decided that it is very important for us to have a place where these children can go in the holidays. And therefore, together with our partners, we worked together and we established a home. So we are happy because we have now a home for our children. We have now started our own primary school, which is the Ewa Primary School. And in the primary school, we have decided to have it as an integrated program, to have our children who are the orphans and also have children from the communities who can join these children so that they don't feel isolated. We sometimes don't even want to call it an orphan. I don't like to call it an orphanage because sometimes it impacts on the children to keep feeling that, oh, I'm an orphan. We don't want to remind them. We don't want to remind them. We want them to feel like they're just part of the community. And they are so happy. They come and tell me, thank you for building us a home. And they call it their home, happily, very happily. And when the holiday comes, you find them packing and looking forward to go to the home. Recently, we tried to leave some of them at the school because they were in primary 7 to read. But I'm telling you, they refused to stay at the school. They said they wanted to go to their home. And we took them to the home.
It's our desire to see these children supported, and we work day and night to see that we can see these children supported. So we keep fundraising every other day.